that nursing is more of a ministry than it is as a profession. And for someone to entrust their life into your hands is a huge risk. As nurses, it's expected of you to save lives or ease the pain of your patients until they pass on. We'll all agree to the fact that there's more to nursing than just earning a living and giving injections. And what you do as a nurse should reflect on your daily life as an individual. I have an interview with a beautiful and a smart midwife who is so much in love with her job. She's been practicing for over 5 years and have delivered numerous healthy babies, including triplets. She recently completed her training to be a lecturer, and I know she's going to channel her passion into raising more altruistic nurses for our country. But before I bring our guest on, I'd like to say a big thank you to Wisconsin International University for sponsoring this whole segment. Please stay tuned. I'll be right back after the break. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suit your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad. It's organic, super absorbent, and safe for every lady to use. A very big thank you to Star Bites, the airport branch. Guys, it's a lovely place. Come meet, eat, and drink. Welcome back, viewers. I have with me Miss Senam Agbodji. She's here to enlighten us on some of the perspectives of being a nurse or midwife, some of the things one needs to know before thinking of applying to be a nurse. Welcome to Health in the Spotlight, Miss Senam.
Thank you. Thank you for having me.
I know you've been practicing for over 5 years. How many years have you been practicing as a midwife?
It's been 7 years now.
It's been 7 years.
Practicing as a midwife.
Okay.
Yeah.
And how has the experience been like?
It's been fun, because I'm passionate about what I do.
Mm-hmm.
And so because of that, I tend to give of my best. And then I love what I do. And then, when you love what you do, it tends to have you like, you have the drive or the soul to give of your best or excel in whatever you want to do. Yeah, sure. So I'm passionate about it.
I think it's a good point.
Yeah.
How, in your own words, how will you describe perspectives of a nurse or perspectives of a midwife?
Perspective of a nurse. Yeah. I believe nursing is a noble profession. And so perspective has to do with your commitment, dedication, and then showing hard work to the profession, showing empathy, just having the qualities of a nurse or a midwife.
Okay, all right. Speaking of qualities, can you give us some qualities that one needs to have to be a good nurse?
To be a good nurse, one has to be caring. You have to show empathy. You have to be dedicated. You have to be ready to serve. Mm-hmm. You have to be committed. You should be non-judgmental also. And then you should be analytical in analyzing clients' information that they give you or something. Yeah. Okay. So that's about a few.
Okay.
Yeah.
Talking about non-judgmental, why would you say a nurse have to be non-judgmental?
You have to be non-judgmental because even in our nurses, but we have a column that says that if the person, no matter the person's creed, color, race, status, and what have you. And so whoever comes to your end, whether the person is a foreigner, the person is a Ghanaian, you have to treat the person very well in accordance with our standards of practice. Mm-hmm. Yeah. Standards of our profession.
Okay.
Yeah, standards of our profession.
Mentioning the standards of nursing, let's talk about nurses' rights and nurses' responsibilities. Are there some nurses? Do you guys have nursing rights and nursing responsibilities?
Yeah, of course. We have rights, and as well as we have rights, we have responsibilities as well. Okay. And so, with our rights, we have rights to be trusted by our own people or the public. We have rights to be respected by our senior colleagues and be corrected by them as well. We have rights to also we work in a conducive and safe environment.
Yeah.
We have rights to promote the growth of our profession.
Mm.
Yes, we have rights to also be fairly compensated for our service.
Hey, are you
Sure.
being fairly compensated?
Talking about fairly compensation, now we can say we managing, because in Ghana everyone is a manager, so we managing with the little we have. Elsewhere, they are fairly compensated, you know. But then in Ghana, we can't talk much. It's just the politics of the day. So we pray we'll get there.
We'll get there.
We'll get there.
Okay, all right.
Sure.
So with also with your responsibilities, can you give us just some few responsibilities?
Yeah, as a nurse or a midwife, you know, when a client comes to your facility or something, you just have to take a thorough history of the client. You try providing health education and then some counseling for the clients, then supports them with their emotional needs. And then some of the responsibilities we can talk of doing the normal vital signs and routine work we do. You take some samples for lab investigations, and then yeah,
Yeah, you're
that's
supposed to
about
be
it.
responsible when you're
When
on work, like when you're
yes,
on duty.
you're on duty, you are responsible for the client. In terms of treatment, you are responsible in providing the treatment. Yeah, now maybe prescribed treatment.
Treatments
Yeah,
for your clients.
for your clients. Yeah.
I know confidentiality is very important when it comes to the medical system. How would you describe the confidential level that I mean nurses? How would you say that nurses are very confidential when it comes to their line of work?
Yeah, we are very confidential in the sense that when you come to our facility and you are ensure we ensure that whatever you tell us in terms of your medical history, your social history, family history, anything else, you are guaranteed that no one else hears of it, because as part of our code of conduct, that you have to ensure confidentiality wherever you find yourself. And so that one, we strictly adhere to it.
You sure?
Yeah,
Because
sure.
you know there are times that you'll be on the ward and the patients that are lying by each other, certain things that this one has told you, it's like you'll be amazed that the other person knows. So you're sure that this confidentiality works.
It works though, but sometimes, you know, in every we have pros and cons, sure.
Okay.
And so that one, I can assure you it's working. But then sometimes, you know, we never rule this, and I don't know whether there's some bad nuts. And so when people talk, they tend to talk aloud from across board and stuff. That's when other patients tend to hear. But then, trust me, nursing has taken a next, or it has gotten to a next level where you're trying to ensure all those things, and confidentiality as a must.
When you were talking about your responsibilities, you mentioned treatment. Now I know that sometimes it's not sometimes the doctors prescribe and then the nurses are supposed to give the treatment. But here is the case, sometimes you end up giving treatments that will cause whatever side effect or will cause an adverse reaction in a client. In this case, who covers the nurse? Or in this situation, what would you do as a nurse?
No, as if I mentioned earlier, some of the qualities of nurse, you have to be analytical
Yes.
in your dealings or in your doings. And so being analytical here, when a doctor prescribes a drug, with your experience on the job, you get to know that this drug might not be good for this patient, considering the side effects of the drug, and then other history or other complaints the patient presents with, you might know that this thing will interfere with the client's health. And so, as a nurse, if you possess such a quality or such the analytical aspect of it, wouldn't even give that drug in the first place. But then if you do, you are responsible for your actions. That is it. Because we, as part of our responsibility, we have to be abreast with time. We should know what's up. You know, we are advancing what's current in our field of work. Yeah. And so if you have an opportunity, or you're administering a drug if you are current, you will tend to know that this drug is not in use, or this drug might cause this or that. And so with that, you wouldn't even give at all.
Mhm.
But if you do, trust me, you are responsible for your own self.
Have you had instances where nurses have lost their license because of such an occurrence?
Yes, we still sometimes we I want to believe we even have nurses going to court and stuff because of all those things. Yes,
Mm,
but it's just a few.
okay.
It's just a few. Because now we are having young people as nurses who are abreast with time,
Mhm.
who know what's up,
Mhm.
you know. And so they are trying to give up their best.
Yeah.
So trust me,
I know the
as
clients.
a thing of a past, we are going to get
You're
there.
going to get there.
Sure,
And
we're going
talking
to get
about
there.
being abreast, you are getting clients that are also smart. I mean,
Sure,
clients before they come to you obviously might have googled some of their conditions,
sure.
and they are kind of well, and to some extent they are informed about what you are going to do for them, or what you need to do. So obviously, I think you have to really up your game,
Of
because
course,
the lawyers are up. They
of
are
course.
they are
But what we are,
hungry.
sure,
They are hungry for you guys.
sure. So what we are doing now is that day in, day out, we tend to organize workshops and stuff just to keep
Mm,
our staff abreast with time.
mhm.
And so when there's this new product in town or any drug that you want to administer, we have a workshop or a training on that to tell you the side effects of it, why you're giving the drug, the science, and when to give the drug, how to give it, which routes to give, and stuff. So you do all the label checks before you do. You administer the
The
drug
medication.
and the
Oh, okay,
medication.
all right.
So that one, trust me.
So for you as a midwife, working conditions, you said that it's your right as a midwife or as a nurse to have favorable working conditions. Would you practically say that being on the field for 7 years, your working conditions have been favorable?
Mm.
Let's
To
be
me,
honest.
to me, in a way, because that's where I find myself, my facility and stuff, in a way. Because I think the basic logistics and then equipment to work with are available.
Mhm.
And so we tend to use it. Those that are not available, next thing we have a term we call improvise. And so we tend to improvise the little ones we have. As part of the quality too, you should be able to work effectively and then efficiently. So in terms of being efficient, you have to use the available resources you have in giving of your best.
Yeah.
And so trust me, Ghana being a developing country, I want to believe we'll get there.
You're
Sure.
hopeful.
We are being hopeful, we'll surely get there. But then we've been trained in such a way that we can use the available resources we have to give of our best.
Your best. Okay.
Yeah.
So would you say that you are fairly satisfied with the working conditions? Because recently,
In my
yeah,
facility, I'll say I'm okay.
you are okay.
Okay, but I don't know elsewhere because elsewhere, trust me, there's nothing to write home about. And so
Could it be one of the reasons why health workers like nurses actually had to embark on strike recently?
recently, I was basically the conditions of service, salary wise, and then some incentives for our uniform, and then others.
Oh, okay.
And so that's what we're fighting for. It's something we feel, we as our rights to be fairly compensated, and all those things are included.
Mm-hmm.
And so if we are left out, trust me, what happens on the field? We tend to work and then we are not able to work passionately.
Yeah.
We are not able to give up our best.
Mm-hmm.
We tend to work because we feel like we are not really giving what we are due.
Yeah.
And so at the end of the day, who suffers? The client or the
suffers,
innocent
yeah.
patient. And so that's our right, and we need to fight for it. And I pray.
I pray that you hope that
Share
they will listen
Sure.
they will listen to
to
you.
us and
Yeah.
then try and then give us what we are due.
So will you go back? Will you guys go back to strike? Will you go back to the strike again, or have they answered
No,
whatever
because we are still in the process. We are talking it out with our superiors. I mean, the executives of our association, our mother association. So we're on it. we are being hopeful they are able to um, able to do, or at least, if not all, they're able to listen to us and then do some for
Some
us.
of the things.
For us.
Yeah.
And then I don't think you would like to go, because even 24 hours, and nursing going on strike for 24 hours is not easy. It's not easy at all. You can see pregnant women in labor and they have to give birth on the way, because they go and they are asked to go home because there's no one to attend to them. It's really sad.
Yeah.
It's not as if we go on strike and we are happy about it, because we have relations also
who also sick.
get falling sick
Yeah.
along the line. And so we can also sit and say we will do nothing about it. So it's 50-50 here. We want to help the clients, and we feel we have to be compensated as well.
Yeah.
So
I think I can understand the frustrations that nurses go through right now. But would you say that there are better ways of channeling frustrations? Because it looks like most nurses are frustrated and they end up displacing it on their clients. Do you get it? Would you say that even though there are sometimes that you're frustrated by the system, there's still a better way that you can still relate to your clients and still be the good nurse that you're supposed to be?
of course, that is where we start with the qualities of a nurse.
Yeah.
You like let me say this, that the Ghana Health Service itself is a service to the nation. As part of the qualities we outlined earlier, we said we have to you should be ready to serve.
Yeah.
In quotes, you're not looking at the money here, a service to the nation, and so you have to serve at all times. And so trust me, if you possess all these qualities, you should be able to give up your best.
Yeah.
You shouldn't look at whether you are being frustrated either from the house, from your superiors, or you are in to serve. You should show empathy as well. If you show empathy, trust me, frustration will be out of your way, because you're trying to feel what the client is feeling. Yeah. And along the line, you wouldn't come up with that idea of I'm frustrated, because you want to help the client, because you're feeling what the client is feeling. Yeah. You get it? Yeah. And so, trust me, frustration should be out of the game. If you are willing to serve, if you possess all these qualities, then we call you a professional nurse. Yes. If you think you don't possess these qualities, trust me, then you're in the wrong profession. You should just find your passion and then follow and just flow. That is it. So frustration should be out. As soon as you walk into your facility, it's a new thing altogether. Yeah. You should show empathy. You should be passionate about what you should care about the client. You should be non-judgmental. If you possess all these qualities, you are going to give up your best. Yes. Frustration should be out. Of it. Yeah.
I think it's very, very important with what she said about following your passion. And if it's not what you want to do, it's best to leave. Because there are people who actually have the passion, but because you have gone to fill the place. So just to add on, I think that viewers, please, if you really want to be a nurse, go for it. And then if you don't want to do it, don't go for it because you think you are assured of a job. Just do what you want to do so that you create the avenue for the people who want to do it. Senam, what advice will you give to people out there who feel that there are so many misconceptions about nurses and midwives? It's like the nurse is rude, and nurses, some actually say that nurses take people's husbands from them. I know there are misconceptions. As you are here, please, what would you say to clarify those misconceptions?
It's funny. You know, in every profession, there are some misconceptions, right? And so these are some of the aspects of it. Yeah. So it's cool. But I don't think it's so. Because now the young ones, as soon as right from school, people are getting married. And so we're from husband snatching. I'm surprised though. And then people are rude. You know, that was what you said earlier. You mentioned it that people get frustrated because of lack of compensations and then poor working environments and stuff. So if all these things are provided, trust me, we are humans. We are going to give up our best. Yes. Give us what is due us. Give us a comfortable environment to work with. I mean, and we are good to go. We'll give up our best. And to add on to what you said earlier, if people were following us with our earlier interview, we made mention of the qualities of a nurse or a midwife. examine yourself. Even if you've already found yourself in the nursing institution, still examine yourself. Find out whether you possess all these qualities. If you don't, kindly go move out. Create a space for someone to come in. Someone who possesses all these qualities. And then we are good to go because we want to move nursing to another level.
Yeah, it's very
where
important.
We have people who possess all these qualities who are going to give up their best. And at the end of the day, we want to bring out what positive health outcomes.
Yes.
And so we have all these people who possess all these qualities. They're going to bring out the best in us. But if you have the bad nuts among us,
it spoils everything.
It spoils everything. Because trust me, we have the good ones.
Yeah, that's true.
We really have the good ones. Yet they are humble, they are silent about it. So those people are not really heard.
Yeah.
There are some people with their own personal issues, though. Maybe those people didn't really examine themselves to see whether they possess all these qualities to be a nurse or a midwife. So go back, examine yourself. Those already in the profession, you can still do that. Examine yourself. If you can't, just go follow your passion, do what you can do best.
Yeah.
And we are good to go because we want to move nursing to the next level.
Yeah.
Well, when you walk into any facility, you are really welcomed by a nurse, you chat, and then emotionally, you are good to go.
Yeah, okay.
It's
important because the mind, the emotion of someone. I mean, already the person is not feeling well, and they are in a different world with so much negativity.
Yeah.
So when you have good nurses around, it will definitely help them. Thank you so much, Senam.
Thank you for having me.
It's fun having you on the show.
Thank you.
Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suit your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad. It's organic, super absorbent, and safe for every lady to use. A very big thank you to Star Bites, the airport branch. Guys, it's a lovely place. Come meet, eat, and drink. Viewers, I guess I've read some salient points, and I know that we've been very, very educated and it has been enlightening. I think as nurses, we should consider the fact that our patients are actually entrusting their lives into our hands. Let's do our best not to just save their lives, but leave them with good memories. Thank you so much, viewers. My name is Rina, and thanks for watching.